I would really like to tell everybody it's easier to be safe than sorry. See, I went through it. I didn't have a choice. And trust me, I never picked up COVID, I think, from the COVID ward. I have delivered already 16 COVID positive patients till I turned positive myself. And I was the one person that never denied and thought, okay, it is what it is. In fact, Pallavi, you can back me up on this one. You said, doc, take care. And I said, kuch nahi hone wala. We are using all our precautions and we're doing everything by protocol.
Right from day one or two, you were wearing PPEs also.
Absolutely, we were wearing N95s and the works. But I think it is the asymptomatic patient that Abhishek spoke about that has possibly given us our infection, because maybe I talk a lot and I'd sit and chat, and most of my patients are actually close friends now. So what happens is you kind of get your guard down a little bit, and that's where maybe an asymptomatic patient could have given it to me. But having said that, for everybody, please be careful. People of my age, more than 50, definitely we are at high risk. People autoimmune and or any other comorbidities definitely have a higher risk than normal patients. Please do not ignore symptoms. And for the longest time, it was only a mild fever, which was then converting on day 5, day 6 to other things. Abhishek, being so much younger, he had no symptom whatsoever. In fact, he told me, Anita, auntie, I have nothing happening to me. Whereas with me, I kept telling him, son, don't, wait till day 5, wait till day 6, because that was when you crash. So please don't take it lightly. And second thing is, if you suspect yourself to be positive, please go into isolation. Do not expose all and sundry, which is exactly what I did. In spite of everything, the first thing I went and I came home, I told my family, and I got admitted. And Dr. Chatterjee and Suvin were waiting. They had the room ready, and I went and I was in there for 14 days, because you're putting other people with you at risk. So please do not take it lightly. There are buildings that are having fights day in and day out about bringing maids in, and I won't name the building, but people have gotten their antibody levels. And Suvin, this is for you, their antibody levels are 80 and 90. So if you really want plasma donors, we will have to go and catch those maids. And they're all asymptomatic people, so they have got real high loads. Other than us doctors, they're also been asymptomatic and with good viral loads. So if you're going to open up your doors for maids, please take all the precautions that have been prescribed. Do not let your guard down, because if Suvin can bear me out on this, they say the worst is still to come. See, the precautions as far as COVID is concerned is for pregnant and non-pregnant the same. There is no special precaution for a pregnant woman. The only thing that you've got to be aware about is any viremia. If you get infected by the virus, the chances of having problems like sudden intrauterine fetal deaths, intrauterine growth retardation, calcification of the placenta, higher incidence of cesarean sections in these patients, higher incidence of meconium staining of LICA, and resulting in fetal distress is there for COVID positive mothers. So see, if you have to get COVID positive, you will get COVID positive. Now there are 3 different phases of your pregnancy: first trimester, second trimester, third. First trimester and second trimester, you're relatively okay. I mean, worst case scenario, you're not going to really have too much of trouble, because you can get admitted, isolated, given oxygen, and you'll be fine. But if it is at term, so that is where the problem happens. Now you are infectious not only to yourself, to your newborn baby, but you can also be infectious to your family. So isolation is the biggest problem for a pregnant woman. Second thing is the family. Everybody believes that you require all and sundry because you are pregnant and now you have to have a baby, but it's not possible, because you have to get isolated and quarantined. So in the hospital, the pregnant woman has to be so strong physically and mentally to be able to look after herself and the newborn, because they can't be a battery of relatives being encouraged or allowed in the hospital. The third thing is, please, we do not isolate the baby from the mother. They both have to be together the breastfeeding by itself, purely the antibodies and the advantages purely outweigh all the advantages of isolating the baby. The risk from the mother to the baby would be more intrauterine rather than outside. Now, once the baby is born, whether it is a cesarean section or a vaginal delivery, hand washing, sterilizing, maintaining hygiene, wearing a mask, wearing gloves on your hands, or washing your hands ever so often, are basic techniques that all of us, whether pregnant or not pregnant, have to learn to imbibe and make as the new normal and continue living. So there is no need to get petrified. There are people that keep calling and saying, Doctor, homeopathy lo, Doctor, Ayurveda lo, Doctor, Kada lo. I mean, see, there is something funny about this virus. It is not behaving like a normal virus, and we ourselves don't know what is going to work and what is not going to. So just go with the flow, maintain social distancing, use precautions that have been prescribed. Everything is evolving. The recovery rates now are much better than what they were in April and May. So for the simple reason that people are getting more aware, and we as doctors are learning so much more. So please don't get scared because you're pregnant. And I must tell you that the lockdown is really a boon for us gynecologists and obstetricians, because our pregnancy rates are definitely unplanned, but they're high. Honestly, life has to move on. Life cannot be come to a standstill because of COVID. Things are opening up. We are getting better. All of us, have we ever imagined walking around with masks on our face? Initially, everybody would wear it, but wear it on their chin or on their neck rather than cover their nose. But now everybody is aware that if you wear the mask on your face and you maintain hand hygiene, you're good to go. So with basic precautions, societies will open up. The maids, their homes need to run. How many are actually paying all our maids? I mean, I don't want to question anyone, but I am aware of people who have stopped paying, or are giving just bare minimum to their housemaids who have not been working. So the economy had to open. The lockdown was to get the infrastructure settled or more stable to be able to cope with the problem. The lockdown never really was to contain the disease. Now that everything else is organized, the opening up, we are all aware the numbers will go up, but we are better prepared. Because we are better prepared, we know we have better know-how, we know how to treat. We have ICUs, we have beds, we have hospitals which are now willing, doctors who are willing to take in these patients. I think opening up is the order of the day, because the economy has to continue. People have to live. But having said that, precautions will stay. This is something that has affected the world and not only Powai. Let me tell you only one thing very honestly. Like Susan said, easier to be safe rather than sorry. Social distancing, hand hygiene, wearing a mask at all times, but life will go on. Hospitals will keep running. Please believe me when I tell you, we are not the source of your infection. You are the ones that come and infect us. So please don't get scared to come to the hospital. Please consult with the doctors. We're seeing patients who are coming late presentations because of the fear of picking up COVID. So whether it is COVID or non-COVID, people are coming late to the hospital when you're beyond redemption, and you can't hold me responsible for that. I had a patient with a 1.5 gram hemoglobin. Tell me what I could do to help her. She should have come in earlier, but the fear of reaching the hospital and picking up COVID from the hospital pushed her to come in only in the morning. Unfortunately, I lost that patient. So what I'm trying to tell you all is, please come to the hospital. Don't get scared of us. Trust me, we will help you. Everything in the hospital is separate. It's segregated. You're not going to pick up an infection from us. We are the ones who should be scared. And like everybody says, go to smaller clinics, go to smaller doctors. Come on, Hiranandani Hospital has been standing up for you guys through thick and thin. So please don't get scared of us. We're not the ones that are going to hold a gun to your head and distribute COVID as prasad for Ganesh Chaturthi. So please, just come, get yourselves treated, whether it is COVID, whether it is not COVID. And trust me, world is, and our Powai is going to be as nice a place as it's always been.